Hello, everyone. I am Shelly Chadha, and I bring you greetings and best wishes from the World Health Organization on the occasion of this World Hearing Day. This year, the World Hearing Day is extra special for us because we are launching the World Report on Hearing. Developed in response to a request made by our member states, this report shows that currently about one in every five people in the world has some degree of hearing loss. And by 2050, this proportion could rise to one in four. About a third of them require rehabilitation services. So currently, there are about 430 million people in the world in need of hearing rehabilitation services. And this number could rise to well above 700 million by the year 2050. What's important is also that while a lot of this rise is driven by demographic change, a very important contributory factor to this is the persistence of various risk factors. WHO estimates that over a billion young people are at risk of hearing loss simply because of the way they're listening to music, the way they're enjoying, their recreational time. At the same time, about 200 million people, mainly children, they suffer from chronic ear infections and which puts them at risk of hearing loss. And these ear infections can, on one hand, be prevented and they can also be treated so that hearing loss is avoided. What's also important is that most of the people who have hearing loss, they live in low and middle income countries of the world, which commonly lack the services and the resources to address this condition. As a matter of fact, looking at a single tracer indicator about the use of hearing aids, WHO found that there is a gap in services ranging from 74% in high income countries to over 90% in low income countries. We need to bridge this gap. And so the World Report on Hearing, it comes with a clear message. We need to act now for ear and hearing care. We need to act because the growing and the number of people who still have unaddressed hearing loss and ear diseases, this is really unacceptable because urgent action is needed to, on one hand, to prevent and then to address hearing loss across the life course. Because investing in cost effective interventions will bring benefits not just to the people who have hearing loss, but it will also bring benefits and financial gains for the society at large. And so, countries must invest. They must invest to integrate people centered ear and hearing care within their national health plans for universal health coverage. Because the cost of doing nothing is one which we cannot afford. Unaddressed hearing loss comes at a high cost. A high cost to people who have hearing loss, their families, their friends. It affects it in children, it prevents them from gaining education, from learning language, from communication. It impacts their chances of gaining employment. It leads to social isolation, feelings of disharmony, at times relationship problems, and also predisposes to dementia, which now is and is shown to be one of the most common avoidable risk factor for dementia onset. Even if we look at this at a dollar level, annually, unaddressed hearing loss costs the world $980 billion. This is not the cost of providing care, of providing devices, of uh, therapy, of sign language, and so on. This is the cost of not taking action. And the thing is that hearing across the life course is possible. This is what the World Report on Hearing shows. It is possible, and it is possible through strong public health action. Public health action, which on one hand focuses on prevention, which focuses also on early identification and on care and rehabilitation of people who have hearing loss. The World Report on Hearing brings this message clearly. Hearing loss can be prevented to a great extent through public health strategies. Strategies such as immunization against various illnesses which lead to hearing loss, meningitis, rubella, also through taking action to prevent exposure to noise, through legislation, through safe listening practices, through promotion of those, through managing ear infections better. So, all of these and others are strategies outlined in the report through which we can prevent hearing loss. At the same time, when hearing loss occurs, early identification is the key. It is the key for making sure that people have the chance to achieve their full potential in life. It is the key to successful outcome. And the thing is that it is possible to identify hearing loss early at any stage in life, at any age, from a newborn to an older adult, and also from in any situation, whether it is in a community setting, in a clinical setting, it is possible to identify it early, and also using innovative hearing technologies and resources like telemedicine to support us. And once hearing loss is identified, it is possible and it is essential to provide appropriate and timely care. Care with the use of interventions, cost effective and well established interventions like the use of hearing technology, like the use of rehabilitative therapy, making sure that people who need it have access to sign language learning, and also through making sure that there is access to assistive technologies for hearing and services such as captioning. So, hearing care can make hearing across the life course possible. We know that in this we face challenges. We face challenges at all the levels of the health system, at the level of service provision, governance, at the level of workforce, at the level of availability and cost of products, at the level of integration of indicators, at the level of financing. So we face challenges at the health system level. These challenges, we know about them, and these are further aggravated by the fact that, well, the need for hearing care is rising. What is an equal and perhaps even a greater challenge is the lack of awareness, the lack of knowledge, awareness, education about ear and hearing care, not just in the general community at large, but also amongst professionals, ear and hearing care professionals, also amongst policymakers, and so on. So there is a lack of awareness in general. At the same time, what magnifies this to a very great extent is the stigma which is attached to ear and hearing care, the stigma which is attached to hearing loss and ear conditions. The thing is that challenges in this field can be addressed, and the World Report on Hearing proposes those strategies to address these challenges, and it also provides examples from various countries where these challenges are being addressed. It proposes then the way forward. How can we move forward and address ear and hearing care and address hearing loss and ear diseases across the life course, so that so that all people can have equitable access to quality ear and hearing care services in a supportive environment. It proposes the concept and elaborates that concept of integrated people centered ear and hearing care, which is implemented through a strengthened health system. This can overcome the challenges we face. So, integrated people centered hearing care is possible through the implementation of prioritized ear and hearing care interventions delivered through a strengthened health system. And the World Report on Hearing proposes a package of hearing interventions which can be integrated into the health systems, and it also proposes how the health system can be strengthened, how the various pillars of the health system can be strengthened through policy, through education and task sharing, through developing procurement strategies and standards, through integrating indicators for hearing care, through making sure that social protection is available. So, how can these ear and hearing care services be made accessible to all through a strengthened health system? The World Report on Hearing also outlines well the cost of implementing, of scaling up ear and hearing care services in the coming 10 years. This will require, well, an additional investment, of course, to the tune of over $1.3 per person per capita. Making this investment can, over a 10-year period, avert 130 million disability adjusted life years. It can benefit 1.4 billion people over the course of time, over the course of these 10 years, and it will earn or it will bring a return on investment of $16 for every dollar which is invested. That is the promise of scaling up ear and hearing care. And so the World Report on Hearing presents a call for action, calling for action to scale up ear and hearing care to achieve the global target of a 20% relative increase in the effective coverage of ear and hearing care by 2030. It asks member states and partners to act now, act by integrating and advocating for integration of people centered ear and hearing care within the national health plans for universal health coverage in order to drive us towards our vision, the vision of a world in which no person experiences hearing loss due to avoidable causes, and those who have hearing loss can achieve their full potential through rehabilitation, through education, through empowerment. I invite you all to join hands with WHO to help us achieve our vision. The vision, which is, I believe, our shared vision of a world with hearing care for all. I thank you all for this opportunity and once again wish you all a very successful and wonderful World Hearing Day.